NewsBreak26 in southwest New Brunswick. I'm Vicki Hogarth. Here's what's happening in our part of the world. New Brunswick is moving into Level 3, the most restrictive level of the province's COVID-19 winter plan, as of Friday, January 14th at 11:59 p.m. The lockdown will remain in place until January 30th. Schools will only return to in-class learning on January 31st. The move to Level 3 was triggered by the province hitting triple-digit numbers in terms of hospitalizations for the virus.
We currently have 105 cases in hospital and 386 medical staff isolating and have tested positive with COVID. And the forecast shows that by the beginning of February, we could have 220 active hospitalizations. We must do what we can to mitigate the risks to our healthcare system and to ensure we can continue to provide essential and critical services. We previously identified the conditions that would necessitate moving to Level 3, and all of those conditions have now been met.
Level 3 has been modified to allow for some non-essential businesses to remain open.
In order to slow the spread of this virus, Level 3 of our winter plan will prohibit all public gatherings, including closing theaters, cinemas, and other entertainment centers. Faith-based gatherings may only take place outdoors or with in-car services. Organized team sports are prohibited for gameplay, competition, and practice with people outside of your household bubble. Individual sports that can be conducted outdoors, such as skiing, skating, and snowmobiling, are permitted as long as distancing is maintained with those outside of your bubble. Buildings that support outdoor sports, such as ski lodges and warm-up shelters, may only remain at 50% capacity, and food and drink must not be served. Gyms, spas, and salons must close for the duration of the Level 3 restrictions. Restaurants will be limited to drive-through, takeout, and delivery only. Retail businesses will remain open under the same conditions as Level 2. This is a change from the original winter plan. Contacts during shopping are generally short in duration and in small numbers for transactions, which reduces the risk of transmission.
Along with a spike in hospitalizations, New Brunswick is currently recording over 1,000 new cases of COVID-19 a day. Projections show the province reaching the peak of the Omicron-driven fifth wave in a few weeks' time, likely by the end of January or beginning of February. At this time, hospitalizations will likely reach around 220 COVID-19 patients, with the province forecasted to record about 5,500 new cases a day. Dr. John Dornan, CEO of Horizon Health, insists a lockdown to control the spread is necessary, not only in terms of the number of hospitalizations, but because healthcare workers are overworked and under enormous stress navigating the fifth wave of the pandemic. Hundreds of them are currently off work after having contracted the virus.
We are suffering in our healthcare system, and we just simply cannot tolerate 220 inpatients with COVID. And it's not just 220 inpatients with COVID. Our buffer is further eroded because people are off. People are off for stressful reasons, and people are off because they have COVID, and people are off because they have contacts. And it's not a simple COVID contact that puts you out for 2 weeks. We are asking our staff to come back in that have COVID infections to look after our patients. Now, they look after people that already have COVID infections, but we are adding to the stresses of our staff by asking them to step up. And we're here with our glove in hand or cap in hand to ask the community to follow us and step up and reduce contacts.
That's all the news I have for you. For more stories and live-streamed COVID-19 updates for New Brunswick, follow us on Facebook at CHCO-TV.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.